Bronny James's cardiac event. A closer look at heart health in young athletes. LeBron James's son, Bronny James, a promising 18-year-old athlete and hopeful NBA prospect, recently suffered a cardiac arrest while practicing for a basketball competition at USC College. The incident has sparked widespread concern and interest in heart conditions, particularly in athletes. This video will dive into the causes of cardiac arrest, including genetic factors, congenital issues, lifestyle factors, infections, and drug use. We'll discuss the symptoms, how to recognize a cardiac arrest, testing, prevention, and treatment examples. Athletes and heart problems. While it might seem counterintuitive, athletes can and do experience heart problems. Regular physical activity does generally protect against heart disease, but for a small subset of athletes, intense exercise can actually trigger cardiac events. This is particularly true for athletes who have an undiagnosed heart condition. These conditions can range from abnormal heart rhythms to structural heart problems like hypertrophic cardiomyopathy, which is a common cause of sudden cardiac arrest in young athletes. Causes of cardiac arrest. Genetic factors. Some people have a genetic predisposition to heart conditions. This could be due to mutations in certain genes associated with the structure and function of the heart cells. Congenital issues. These are problems with the heart structure that are present from birth, such as a malformed heart valve or a hole in the heart. Lifestyle factors. Poor diet, lack of exercise, smoking, excessive alcohol use, and drug use can all contribute to heart disease. Infections. Certain viral or bacterial infections can cause inflammation of the heart muscle, myocarditis, which can lead to a cardiac arrest. Viruses. Certain viruses can cause inflammation of the heart muscle, known as myocarditis. This condition can lead to a serious heart rhythm abnormality or heart failure, potentially causing cardiac arrest. Common viruses associated with myocarditis include the Coxsackie virus, parvovirus, Epstein-Barr virus, and more recently, the SARS-CoV-2 virus, which causes COVID-19. Drug use. Some legal and illegal drugs can cause cardiac arrest. Cocaine and methamphetamines. These drugs can cause coronary artery spasms, leading to a heart attack, or they can cause fatal arrhythmias. Long-term use can lead to the development of cardiomyopathy, a disease of the heart muscle that makes it harder for the heart to pump blood. Opiates. These drugs can slow down breathing, reducing oxygen supply to the heart, which can cause cardiac arrest in overdose situations. Tobacco and alcohol. Long-term use of these substances can lead to a number of heart diseases, including heart attack, stroke, arrhythmia, and heart failure, all of which could potentially result in cardiac arrest. This includes medications that might be used for performance enhancement in sports. Anabolic steroids. They can cause an increase in blood pressure, changes in lipid metabolism, and left ventricular hypertrophy, all of which increase the risk of developing coronary artery disease and subsequent cardiac arrest. Stimulants, amphetamines, ephedrine, and others. These substances increase heart rate and blood pressure, which can cause stress to the heart and result in arrhythmias or heart attacks, potentially leading to cardiac arrest. Erythropoietin and other blood doping agents. These substances increase the viscosity of the blood, which can lead to clots. A clot that blocks blood flow to the heart can cause a heart attack and subsequent cardiac arrest. Dehydration. Dehydration can affect anyone, but athletes are particularly at risk because of the high amounts of water they lose through sweat during intense physical activity. Inadequate fluid intake before, during, and after exercise can lead to dehydration. Dehydration can have serious effects on the body, including a reduction in blood volume. This can cause the heart to work harder to pump blood and deliver oxygen and nutrients to the cells, which can potentially lead to a cardiac event. Some symptoms of dehydration include thirst, less frequent urination, dark-colored urine, fatigue, dizziness, and confusion. Hypertrophic cardiomyopathy. Hypertrophic cardiomyopathy, HCM, is a condition in which the heart muscle becomes abnormally thick, making it harder for the heart to pump blood. This condition can lead to life-threatening arrhythmias, or abnormal heart rhythms. It's often genetic and tends to run in families. HCM is a common cause of sudden cardiac death in young athletes. Often, the first sign of the condition is a cardiac event like sudden cardiac arrest during physical activity. Hypertrophic cardiomyopathy is characterized by hypertrophy of the cardiac muscle, which means the heart muscle is abnormally thick. This is most commonly seen in the interventricular septum, the wall that separates the left and right ventricles. Upon histological examination, the most characteristic finding is myocardial disarray, where the normal parallel alignment of the cardiac muscle fibers is lost, and the fibers are oriented in multiple directions. This disarray is usually most prominent in the areas of greatest hypertrophy. In addition, there may be small vessel disease characterized by thickening of the small intramural coronary arteries. There may also be interstitial fibrosis, which appears as excess connective tissue between the muscle fibers. The fibrosis can be a response to the abnormal mechanical stress due to the hypertrophy and disarray, and it contributes to the stiffening of the heart walls. It's important to note that while these are typical histological findings, the severity and distribution of these changes can vary greatly between individuals with these conditions. Myocarditis. Myocarditis is an inflammation of the heart muscle, usually caused by a viral infection, including viruses like influenza, the flu, or COVID-19. Myocarditis is characterized by inflammation of the myocardium, the muscular tissue of the heart. On histological examination, we often observe interstitial inflammatory infiltrate, which is primarily composed of lymphocytes, along with occasional macrophages and neutrophils. Other immune cells such as eosinophils may also be seen in particular forms of myocarditis like eosinophilic myocarditis. Focal or diffuse areas of myocyte necrosis may be observed due to the inflammatory response. There may be associated edema, swelling, and congestion in the heart tissue. In chronic or persistent myocarditis, one might also see fibrosis, scar formation, in the myocardium. Furthermore, viral inclusion bodies may be seen in the case of viral myocarditis. In severe cases, the inflammatory process can lead to dilated cardiomyopathy, in which the chambers of the heart are enlarged, and the muscle is thinned and weakened. Myocarditis can affect the heart muscle's ability to pump and cause rapid or abnormal heart rhythms, arrhythmias. A severe case can lead to heart failure, sudden death, or lifelong heart problems. Athletes with myocarditis are recommended to refrain from competitive sports for at least 3 to 6 months. Arrhythmia. An arrhythmia is an abnormal heart rhythm. The heart may beat too quickly, too slowly, or irregularly. Arrhythmias can occur with a normal heart, or as a result of heart disease, electrolyte imbalances in the blood, injury from a heart attack, or the healing process after heart surgery. Arrhythmias may not cause any signs or symptoms. In fact, your doctor might find you have an arrhythmia before you do, during a routine examination. Noticeable signs and symptoms don't necessarily mean you have a serious problem, but it's important to get checked out if you have them. Recognizing cardiac arrest. Cardiac arrest is a serious and immediate life-threatening condition. It usually occurs suddenly and without warning. Symptoms may include sudden loss of responsiveness, no response to tapping on shoulders, no normal breathing. The victim does not take a normal breath when you tilt the head up and check for at least 5 seconds, and no signs of circulation, no movement or coughing. Testing and prevention. Anyone who participates in competitive sports should have a pre-participation physical examination. This should include a careful review of the person's personal health history, family health history, and a physical examination. If a potential heart condition is suspected, further tests such as an electrocardiogram, ECG, echocardiogram, or stress test may be recommended. Treatment examples. The most important response to cardiac arrest is immediate treatment with a device called an automated external defibrillator, AED, which can shock the heart back into a normal rhythm. Following immediate treatment, a person who has experienced a cardiac arrest will need to be evaluated and treated by medical professionals. In summary, Bronny James's recent cardiac arrest underscores the importance of heart health awareness, even in young, fit individuals. Regular physical examinations, awareness of symptoms, and healthy lifestyle choices are all vital for prevention. While cardiac arrest can be a fatal event, quick response and treatment can significantly increase survival rates. For more detailed information and conversations on health-related topics, be sure to check out our MD Talk Health and Fitness channel on YouTube.